Good morning or good afternoon, everybody. Welcome to the last UICC Virtual Dialogues for 2020. Obviously, it's not going to be the last ever. We're going to be back in the new year, but we're certainly going to finish the year on a very important topic. There's nothing better than leadership to cap a very challenging year. And this is going to be the first part of the conversation. We really think it's going to continue in the new year as we explore emerging and new aspects of leadership as the leaders of various cancer organizations from across sectors work through the crisis and beyond. So today we have a fantastic panel of speakers and a fantastic moderator. So I'm not going to take too much of your time. We have an hour for this discussion. The usual ground rules apply. Keep your microphone muted unless you're speaking. Keep your video on so we can see where you're connecting from, and do switch on the chat box and do post questions that our moderator and our panel can pick up in this conversational dialogue that we're going to see today. So, as I mentioned, we have a fantastic lineup of speakers, and without any further ado, I shall pass the word to our moderator for the day, Kerry Adams. Over to you.
Thank you very much, Alessandro. Thank you very much indeed. And thank you to all of you who have dialed in today to listen to a stellar panel to discuss the challenges of leadership through the crisis of the pandemic, which I thought back in March would last a few months, and we're at the end of the year and we're still in the middle of it all. So it's been a challenge for everyone, personally, organizationally, as well as the society. So we have a panel today. We have Ulrika from the Swedish Cancer Society and also a UIC board member. Thank you, Ulrika, for joining us. Peter is Chief Executive Diaceutics, a UIC partner. Thank you very much, Peter, for dialing in. Mark is dialing in from Australia, so I don't actually know what time it is there, but thank you, Mark, from dialing in. He's the Chief Executive of the ICON Group. And we have Omo, who's dialing in from Nigeria, isn't it? Nigeria, Omo, isn't it? I think it is Nigeria. And she's recently been received the UICC CEO of the Year Award. So we thought it was only appropriate to invite her to join us on this panel to discuss the leadership challenges of facing the crisis. This will be a general chat. We will not do presentations. We may use a couple of slides later, but it's a general chat, and I'll invite each of the panelists to give their view and perspectives on what they have seen this year. And also we'll start looking at what we think will happen next year and what the challenges are for organizations in the face of the post-COVID crisis, which will be economic generally, I am sure. Anyway, let me pass over to Ulrika first of all. Ulrika, perhaps you could give us some views about, what's it been like as the CEO of the Swedish Cancer Society for the last 9 months, and maybe what your personal learnings are and how have you dealt with it as a CEO?
Well, actually, it's from a professional view, it's always quite exciting, and I need to actually admit that to be part of a crisis and to be able to work as a CEO during a crisis. But of course, the first thing we did was to sort of get some kind of understanding of what the situation is. It's going to be long-term or short-term. Of course, in the beginning, we didn't know, but we sort of created a dedicated COVID group, a sort of a small crisis team. And they are still in function to follow the development, to update information internally, and to prepare policies and guidelines. And that gives a sense of calm to other staff members who feel that they can now relax, and that we have a dedicated team looking at the COVID development from a sort of security perspective. And then, of course, it was a challenge starting to think, well, what kind of activities can we keep? Where do we need to change? And some activities were of course postponed, and some things we weren't able to do. And looking at what kind of activities we need to sort of step up, like for example our cancer helpline, and to do certain reports of how our cancer treatment and cancer research being affected by the COVID crisis in Sweden, to give guidelines to the authorities since we're quite strong in advocacy, but also to secure our future fundraising, because we're the fundraising organization. So we had to go to online fundraising and to secure that we could to work with our partners in a new way. So instead of furloughing staff, we have recruited a lot of digital competences and introduced new members of staff. And of course, this creates tensions and curiosity among members of staff, because some people who have been sort of there's a power shift within the organization always when we are in a change process. And of course, no one talks about it openly, but as a leader, you can feel that kind of shift in power when people have been sort of the internal, not heroes, but who have had really important tasks. So suddenly those tasks might not be needed any longer, that there are other tasks needed now and competences for the moment. And now we're sort of finding a way back to some. And we'll always have members of staff feeling that, well, can things just go back to normal, or we just do a lockdown and we just wait until this is over? And then you have members of staff who thinks this is really sort of exciting, and how can we change now? And you have to, as a CEO, meet all these kind of reactions among your team members, and deal with it, and still stay calm and supportive and energized as a CEO yourself.
I think we all recognise the need to stay calm, and as an NGO, UIC is exactly the same position as you are. I mean, now our funding lines have been challenged during the year and will continue to be challenged next year. And I recognise, the challenges of stopping work. I mean, we as you know, we stopped our Congress this year. We cancelled our summit, and we have a Congress team that was furloughed immediately. As a result of that, and being in Switzerland, we were able to get furlough support from the government. So yes, I mean, the whole makeup of an organisation like ourselves has changed significantly. Mark and Peter, you both run businesses, so not NGOs. So you've probably faced slightly different challenges. Mark, can I pass to you? What have been the big challenges that you face this year as a leader of your organisation? I must admit, I do admire your comms team. They are constantly using LinkedIn to share knowledge and ideas and views and keep the icon community together. But I mean, you must be very happy with the way that you've kept your team focused on delivering the services that are so important to the cancer community.
Yeah, no, thank you, Kieran. Thanks for the invitation to join such an esteemed panel. Look, I think you hit on a very important word there in that brief introduction. That's about connection. So we made the decision very early on. We saw what was happening at our cancer centres in China, Singapore, Hong Kong before COVID really became an issue in Australia, and so we knew what was coming. And I'm going to break it down into really simple terms, because I think this is what people can connect with. And very early on, I said to all of our team, 3,000 people spread across multiple countries, that the way ICON would deal with this and the way I would lead through this was really going to be just summarised by 3 words. That was calm, connected, and committed. And the whole team has used that as a mantra. We haven't stopped. And, it's my email signature to every single person when those communications go out from me. Look, the things that I learned very quickly was the intensity of the decision-making process in the early part. There's no time to overanalyze. There's no time to navel gaze. You've got to make decisions, and you've got to make decisive decisions, and you've got to have frameworks with which you would make those decisions. And my frameworks were very, very simple. We made the commitment to each other that we would stay open no matter what came our way, and we would protect our people and protect our patients. And we've done that so far, which has been really, really rewarding. The things that I was really looking for, not only from myself, but from our other senior leaders was, okay, we're already an organisation in multiple countries, so we're geographically isolated. We had people cut off in China, we had people cut off in Singapore, people cut off in Melbourne. How do we remain connected to those people when we can't see each other, can't travel? So what I wanted to do was be more visible than ever. And how do we achieve that in a virtual environment? And, which meant, look, every week I did a Q&A with any staff that wanted to dial in. We answered every question. For 62 days straight, I emailed everyone good morning every single day. Now, and not only was that a way of keeping people connected across the entire team, and this is the focus for today, it actually gave me a connection point with people, and there was a huge amount of interaction as a leader. And in many ways, that's the motivation you need. You're getting the feedback from your teams that, hey, we're okay. We're doing okay. Yes, it's challenging, it's tough, but we're all united on the mission, and that is to keep looking after the people who really need us. So, look, 3,000 people, I would say that ICON has never been more connected as a team than we are right now. And it's because of what we've been able to achieve over 2020. Yes, it's been hard, but we have learnt a lot as organisation and as individuals. So if I was to summarise the leadership journey, Kerry, I think it's about, visibility, and some of these things you might view as being quite old-fashioned. Anytime my team saw me, I'm not going to look tired. I'm not going to look sleepy. I'm not going to look stressed. I'm going to look strong. I'm going to look like we've got everything under control. Doesn't matter what's going on behind closed doors. That's what they're going to see. And, the optics and the simple mantra of calm, connected and committed, those things work. And I call them the 1%ers, and they're real. And people in times of uncertainty are looking for certainty. And that's, as leaders, that's what we've got to provide. I've enjoyed the connection with our staff that has been facilitated by, I had more than 2,000 replies to those emails, and I took the time to answer every single one of them personally. You can't buy that connection. That's real, and it works, and it's been delivered to us by a crisis.
Well, that's really interesting that this calm, connected and committed and staying calm all the time. It's not been a year that's really helped stay calm, because we've all faced challenges that have appeared from nowhere. Difference in the way that we operate our organisation, with members of staff having COVID, causing panic, and worries and concerns. And then we've added on top of that, we have families as well. I mean, I have my family in the UK. I'm worried about them. I've got family down in Barcelona as well. So it's a difficult time. Peter, perhaps I can come to you. Your company, Diaceutics, I mean, you've obviously, you're important to the cancer treatment continuum. You've got lots of people invested in. What sort of challenges have you faced as a leader of your own organisation, and how's it gone for you?
Again, echo Mark's words. Thanks very much for the invitation to sit on the panel today and share some thoughts. I just as I was listening to Ulrika and Mark speak, I was kind of nodding internally at the setting up of the task forces, the emphasis on communication. These are all things that I think we've endeavoured to address in Diaceutics. Diaceutics is a slightly different company going into the pandemic. We were already virtually located, although there's only 140 odd people in the company. We were located in 17 jurisdictions. We already had the seamless communication systems in place that would allow people to work from their home environments, or as we described it, a kind of a distributed network. So on the surface of it, we were pretty well placed to walk into the pandemic. However, we, every almost 18 months, like to come together as a team into a location. This year, it was Tenerife. And I remember there was so much concern. The meeting would have been around March of this year. There was so much concern by the team members of, what was unfolding, if you can remember back then. And particularly our team in Asia, we have members in Korea, Taiwan, China, Singapore. And of course, they had, if you like, started to see the emphasis of the pandemic on their own social and personal lives, as well as their careers or their professional lives earlier than anyone else. And they had already just taken the decision that they would not be able to travel to our ACM. But there was one particular morning, and I would say that it was one of those, I suppose, personal crisis moments where actually my wife came in and said, have you just heard the news that there is an outbreak of COVID in the hotel next to the hotel that you're booking to have your conference in? And I sort of really brought it home to me that obviously it was not appropriate to ask any of my team members to travel. And this was a crisis that was unfolding at speed. And we cancelled the meeting. What we replaced it with, interestingly, was not just a virtual meeting where we had 140 people join us, but we asked all of their families to join us as well. And we literally went round the team, and we got to meet partners, husbands, wives, children, dogs, pets, and it didn't necessarily replace the magic of 140 people being in a room after 18 months of working together, but it did somehow contribute to a sense of community. And we described Diaceutics as a global village, and it was a virtual global village. And it was a moment that I think cemented the journey for us for the rest of the period. And that has been very helpful. There were two other things maybe I'd throw in terms of things that we've done that were unusual, a departure from the norm. The first is we spend a lot of time in Diaceutics gathering data on testing. It's really important that we have a real world view of how mostly cancer patients are genuinely how their journeys, as we describe it, are being managed. And the first thing we did was we made sure that the data that we were gathering from March, April, May, June in all of the key markets would intensify. We would try and improve the frequency of that data extraction from both laboratories, from insurance companies, and that we could start to form a picture of what was really happening here, because all of us in leadership thrive on information. And the better the information, the better your decision making will be. Now, this is information we're gathering not just from a corporate point of view from managing Diaceutics, but it is information that I think will become important in the future. And we have some slides later on, hopefully I can share with you the output of some of that information. So I think our team mobilized around the gathering of data that was related to COVID plus cancer. That was the lens that we set our eyes on. And that, again, was a mobilization. The last one was, interestingly, this 2020 was a year for us where we were launching a platform, a kind of a global marketplace for cancer diagnostic testing. And if you're launching a platform, if any company's launching a platform, you really assume that it will take anywhere between 18 to 36 months to get activity onto that platform. You're moving your pharmaceutical clients, you're moving your laboratories, you're releasing your data. That would be the general expectation of the diffusion curve of a new platform in healthcare. But really what happened, of course, was there has been a shift to digital, unlike any shift that anyone else has seen. And everybody's looking at that shift to digital and saying, what does that mean for us? Well, for us, it meant two things. Number one is that we were able to introduce our platform to a very, very receptive audience. Our laboratories, who were themselves struggling with our network of laboratories, kind of struggling with information. They were very eager to be connected. Our pharmaceutical clients, very eager to be connected. So that was hugely useful. So in many ways, we've had an accelerated start to the introduction of that platform, which is good. And the other thing was we went out and raised $20 million. We're a public company, we're listed on the AIM market. And it appeared to us that there was an appetite from our shareholders to make sure that organizationally we were ready for what comes next. And the best way to do that was to make sure that we were topping up our coffers. So it seemed maybe counterintuitive. Why would you raise money in the middle of a pandemic? But actually for us, we raised $20 million in under 5 weeks, which for an organization of our size was a kind of a huge, a kind of a war chest sitting in our back. And as we come out of this, we're looking at how do we deploy that for the purposes of our mission, which is to really help and support cancer patients getting tested better. How do we use those funds as we're coming out of it? So those were a couple of internal data gathering and some kind of readiness for the next stage activities that we undertook.
Peter, that's fascinating that you're already thinking about the next steps and taking opportunities as they arise. Perhaps I can move over to Omo. Are you there, Omo? I can't see you now. You were there a moment ago. She's not there. Have we lost Alessandro?
Yeah, no, the connection wasn't great. I sent her some dial-in number.
Well, let's carry on with the conversation. I'll bring her in when she joins. Ulrika, Peter's been able to secure funding.
She's back. I can see her now.
The world, it's a great. Omo, you're there. Omo, hi. Can you hear me? Okay.
Yes, I can.
Right, great. Why don't you tell us the challenges that you face as a leader in your organization and how you've dealt with them?
Thank you. And it's such a pleasure to be here with esteemed co-panelists. So when the COVID pandemic hit Nigeria, we thought it was going to be short-lived. But very quickly we realized the lockdown was going to affect us in very severe ways. So from thinking, oh, this will be short-lived, we changed our minds and then came together as a team. And I have to stress what other panelists have said about quick decision making and communication. And those were two things we did early on, how we had to switch our strategy from everything we had planned for 2020 and switch it online. And so at that point, we also decided what success meant to us. Success for us at Shebekli meant that we were going to move all of our patient database, which was largely physical interactions, to an online platform. And that was pretty difficult because in Nigeria, many patients prefer the face-to-face interaction with navigators, counselors, rather than Zoom meetings or chatting via apps. They want to see their doctors. Luckily for us, we had developed an app called Oncopadi, and we were in the beta testing phase. So we made a quick decision to partner with Oncopadi to move our database there. So success for us was to be there for cancer patients and caregivers, anyone online searching for cancer care, anyone who was stranded. So we defined success very, very early, and every team member now understood what success meant to the organization, to the patients, and to their own professional roles. Just as we got on board and we were changing all our strategies, putting all the components in place to achieve success, COVID then started to hit each team member. I lost a loved one to COVID, and it was harrowing because she spent a lot of time in the ICU. It went on for many weeks. About 50% of my family had some form of COVID or the other, or there was someone we were caring for throughout the process. So on the personal front, a lot of my team members were directly hit by COVID or were caring for someone who had COVID. So there was a point where we had to switch our strategy into survival mode because we were emotionally and physically affected by COVID itself. So, and that takes me to the third point where when we realized, I have a very small team, we're about 7, but we have an army of volunteers, about 200 volunteers who support our work. And about 3 people were directly affected by COVID. So you can imagine there was an imbalance in the work. And it was at that point, we made the decision of sharing our energy. So we understand what each team member is going through, especially on an emotional level. And that was, for me as a leader, that was something I learned. It goes beyond asking, how are you? What are you up to? It goes to, what's going on and how can I help you? These are the various ways we can help you as an organization. And personally, these are the resources now available to help each and every one of us survive. At this point, at the end of the year now, we look back and we are at that point of communicating and agreeing. Did we meet our target? Were we successful? Despite all the challenges, are we successful? And I would say, yes, we hit our targets, we are successful, simply because at the end of the day, we were there for the patients. For every Nigerian patient who's Googling online, searching for cancer doctors, cancer specialists, we were able to navigate them to the hospitals, as well as team members eventually were supported in a way we would never have supported them before. So just to say that it's really about decision making, almost very regular checkups, like what Mark said, where he was reaching out to his team members, but just not reaching out, but giving feedback and responding to each query. I think that is more important to the team than any other thing. Just knowing that the organization truly cares and cares beyond just that human touch to caring for the team. And then just setting the goal and what success looks like, making quick decisions very, very fast, and yeah, sharing your energy. And I use the word sharing energy or borrowed energy because sometimes you have it all figured out, but with COVID, you just can't figure it out. And when you are overwhelmed, you have the permission to drop the work. But somewhere there, we have to learn. And I think this is a bit higher than delegating. It's about, I'm going through this and I need your support. And you should know the team member who can take on that role, not just because they have the capacity, but emotionally, they are also strong and fit to take on that role for other team members.
I'm so sorry to hear about the loss you've had through COVID. I think we've all been affected, but it's been a difficult time for families, and that of course affects you as an individual and as a leader. Mark, if I could come back to something that you said, if that's okay. You said about taking great quick decisions, and sometimes with not all the information available. And certainly I think this year has tested people's confidence in making those good big calls early on what we should stop, what we should hold off, what we should do, and how we should reconfigure the organization. Could you give us some insights on how you do that? And by way of introducing the subject, I've noted that Christiana Fonseca is a board member of UIC. She's on the line. I've got Ulrika, and I can just say that from the board perspective of UICC, we made enormous decisions over a 2-week period, big decisions. Delaying our Congress and cancelling our summit was a big decision, not just because it's a flagship event for the whole of the UIC community, but also the financial implications of that decision were enormous as well. And we have to cover those costs within our reserves, etc. So they were big decisions. And I admired our board because they were able to look at things without all the information, because at that point, it was end of March, beginning of April, and we made a decision we were not going to have face-to-face for the rest of the year. And there were some organizations saying to us, aren't you being a bit negative? Aren't you, assuming the worst? And looking back now, I think we assumed the minimum. but we made those decisions cohesively. It was a good debate, good discussion. And we got to a set of decisions which I think have served us well this year. So Mark, perhaps you said about quick decisions. How did you go around those quick decisions? What was it? Was it you? Was it your management team? Was it a board's decision? How did you get to those conclusions?
Well, I think the first thing, Kerry, is, and you've just talked about it with the board, you know, as the leader, you've got to surround yourself with experts, people that you trust and people who will come to a decision in a timely fashion and with the information at hand. And I just want to give I think it's a really good example. So obviously at the very, the onset of the global pandemic, your people who are delivering care are very, very nervous and they're scared because it's the unknown. They're looking after sick people. They don't want to get sick themselves. They've got families, as we've just heard I talk about as well. People have a lot of pressures on them. They're really scared. So, we had our teams, no matter where they were in the world, saying, we've got to put masks on straight away. We've got to be in PPE straight away. Now, I knew that if we did that, we didn't have enough PPE at that time to last. So we had to have disciplined frameworks about when we would introduce full PPE, how we would escalate, and then how we would de-escalate, because it would have been disastrous to bow to the pressure of people who felt unsafe and put everyone in PPE and then get halfway through and say, oh, sorry guys, we've got nothing left. And we all know the pressures that became on all healthcare providers around PPE globally. So you had to have the discipline to back, a team of people's decision based on science about when we would put people into PPE, when we would escalate through certain levels of response, and then how we would de-escalate. Because if you get it wrong, the consequences are dire. Now, I'm really pleased to say we got it right, and we're during the time where we were escalating people in PPE, when it was all based on the metrics of, community spread of the disease. We were able to protect our people, and then everyone could see, hey, that was really sound decision making because it was based on science. Now, we had to make that decision very, very quickly, and I had all of my clinical leadership group, and when I talk about quick decisions, I'm talking about, meeting every single day for 2 or 3 days at length to come to consensus. And but ultimately, and I think this is a really important point. As the CEO, the buck stops with me or with all of you as the leader. Ultimately, it's got to be someone's decision, and that responsibility, I think, is the thing that weighs most heavily on all of us as leaders, because ultimately the decision is yours. And those quick decisions we need to make have to be made by someone, particularly if there's not consensus. You cannot spend your time, with inertia when decisions need to be made. The only other one I'd share with you as well too, Kerry, is, we wanted to be ahead of the curve. And, I had made the decision that our head offices in Singapore, Brisbane, Beijing and Melbourne would go to remote working before the Australian government, for example, had made that call, because we wanted to be ahead of the curve, and we were, and it was the right decision. However, people were scared. People were worried. We're heading into the unknown. Our IT team were faced with, within the space of 24 hours, having 400 people working from home. And they were able to deliver. But, the intensity of the decision-making is very, very stressful for teams, and it's very, very stressful for leaders. And I'll just come back to a point I made when I spoke earlier in the session. They will look to people for certainty. When there is uncertainty, you want certainty. And, I was at a point where I'm going to make a decision. I'm going to stand by it. We will push through. Was every decision perfect? No, but I did have another saying, which I'll share with everyone, that, and pardon the pun, that speed trumps perfection. And that's where we were at certain times. We had to make fast decisions, and they weren't all going to be perfect, but got us through and kept our people safe and kept our patients safe. Kerry, you're on mute.
Yeah, I agree with you completely about the quick decisions. From a UIC perspective, we had 3 things that we were aiming to do. One was to make great quick decisions, which we did. One was to protect our liquidity during the year as much as we could, to go into what we thought would be a very difficult year in 2021. And also to make this, and to de-risk the organisation, to stop taking riskier projects, programs which are unfunded, but to delay all of those until we were in a position of a greater understanding of the implications of COVID on our membership, which became our focus for the year and going into 2021. Peter, it seems that you took some pretty quick decisions as well. I mean, going into the market and getting another 20 million was I haven't heard any other organisation use the opportunity to secure more funding for the future. But presumably, your management team, yourself and others were able to make quick decisions with the information that you had available, even though you were saying earlier that, you wanted to get as much data as possible so you could make good decisions based on evidence or good projections. So how did you go about that?
Well, I think, one of the things that we were able to do is to literally reach out and speak to our community beyond the walls of the company. And so through the months of March and April, we had a policy of calling as many of our pharmaceutical clients and as many of our laboratory partners as we could, and we asked them what were they facing, what were they going through. And I suppose really what came back, there was a kind of an unfolding and evolving situation. If you asked, as we did, we asked, executives in March and April, there was a sense of this will be all right, we'll be fine. Yes, things are changing, but we're coping. If you move that to August, September, I think there was a sense of accumulated fatigue in the kind of the business and the clinical community of, my goodness, this is going on. But humanity, I reflect this both inside in my team, maybe in my own head, but also with our clients. Humanity is in a phenomenal way of reacting, and even when it kind of goes into that kind of mental nosedive, somewhere in that mental nosedive it says enough. You have to kind of face up to this crisis. It is about demonstrating leadership, and I know our conversation today is about leadership for ourselves on this panel, but I think probably all of us would have examples of leadership at every one of our team levels. And you know that around you, both in with your clients, with your laboratory partners, and indeed across your team, you know that the world is opening up to the challenge when they start coming up with new ideas and new ways of addressing things that they are doing. And I would say that one of the highlights, if you like, or maybe pleasures for me in the last while has been to see that people are making decisions all over the place. And some of our clients, pharmaceutical clients, for example, are making decisions to move programs that would never have been digital onto digital instantly, just go straight to, even though there were challenges. I've seen there's a major cancer conference in the United States, as you know, called ASCO, and ASCO went virtual this year, became VASCO, and within a space of weeks, this, what would have been a very large congress in Chicago, went online. And it actually was a really successful meeting. And everybody just got behind the program. So speed trumps perfection. I really like Mark's statement there. And I think we have genuinely seen that speed of response, both from the grassroots, but also from leaders elsewhere. And yeah, it has indeed been an extraordinary period of moving quickly. Some things haven't worked well, but there's more things that have worked well. And I think we will come out the far side of this and be able to reflect that our organizations.
May I add on to that? Because I think, Carrie, would it be okay to just comment on that?
No, go ahead.
Yeah, because I think it's and I really agree with both Mark and Peter about the speedy decisions. And I think we've all become much more agile, and we're quite good and strong in decision making and also changing decisions as CEOs and leaders. And I'm not worried about that. But for what I see is a bit worrying in the coming month or in coming 6 months is taking strategic decisions, because I think strategic decisions that are not reacting on things happening right now, but thinking more long term. And I think I've lost a bit my ear to the ground, because I have a lot of conversations with my stakeholders, I have with some of my competitors, but I've lost the sense when I meet people just when I mingle, and suddenly I just happen to hear something, someone is talking about something. So now I'm a bit worried that I will react to things when they have already happened, a bit too late to take new, dare and brave strategic decisions, because I haven't got the ear to the ground externally, meeting all external stakeholders and people that I don't really connect to normally, because it takes some kind of effort to go on a meeting and to call up someone, but I miss the ones that I don't naturally connect to. And I'm a bit worried that will make us a bit too narrow when we take our strategic decisions. We've just taking on a new strategic direction that we hope will take us in the right direction for the coming years. But still, I haven't got that kind of natural intelligence that I always need when I take bold decisions. And that is something I'm a bit worried about. And I don't know how you feel about that, because you're connected to all your staff, you get all the right information and facts, but there is something that I feel disconnected to. And I might be the only one having this feeling.
Ulrika, that's really interesting. And perhaps I could pass back to Peter, because in the last 15 minutes or so, I'd like to move the discussion on to the leadership thinking about next year. And Peter and his team have already done some thinking about what the next year will look like and what the major issues will be in the cancer community. So Peter, I think we have some slides that you very kindly sent through. I don't know if Lorenzo, you could bring up those slides, just a couple of slides to show the way in which he's thinking about the future and looking at data and analysis to draw in some good strategic decisions. So Peter, would you like to go through slides very quickly?
Yeah, we'll do. And I'll just come back to Ulrika's comment. Ulrika, I'm just smiling when you were saying that intuitive sense of ear to the ground. I have to say, I echo that. You do feel as if you're worried about what you don't know. And that's a very uncomfortable position. I'll just very quickly go through these slides because I'm really interested in opening up for conversation. So I mentioned earlier that we were really trying to get out in front of the so what's coming next. And we've kind of phrased a program within the company, which is both data collection and analysis, what we've called COVID's cancer chain reaction. Bit of a mouthful, but what we're saying is, what is the impact of COVID on cancer and in its long-term disease sequelae? And I've got a couple of slides. The first one here is in China. And what you're looking at here on the left-hand side is, what was the drop-off in the number of cancer hospital visits in various regions in China through the months of January, February? And you know, we were seeing this much earlier in Asia than we were elsewhere. It was a kind of an early bellwether. And there you can see those numbers really dramatically, patients staying away. We've heard it anecdotally, but these are patients that were staying away who would otherwise either have been diagnosed early or who were due to get treatment. And then on the right-hand side, we've been partnering with Kantar, who've been looking more down in an individual disease level, says, what is the so what of that? And you can see everything that's kind of in amber or red on this slide on the right-hand side saying this is a kind of a shift into the negative. So things like the number of biopsies that were done, the use of surgery, again, evidence that something has happened in this year with cancer care, which we have to start to think about. If you move on to the next slide for me, please. And again, in the US, so what you're looking at here are pathology test volumes for the last 36 months. And you can see there's always peaks and troughs. But look what happened from January, month 25 to month 30. A dramatic drop off. In some of these diseases, you are looking at a 30% drop off in number of patients presenting or being tested. Now, you can't preside over that type of dramatic shift in clinical care and not ask yourself, what is the consequence of this as we come out the other side? And what we're trying to do, if you move to the next slide, is almost draw and follow a hypothesis. Now, this busy slide, forgive me for a second and let me explain it to you. So what you have on this slide is a kind of a sense to try and anticipate what's going to be happening as we move into the middle of next year. A couple of things are happening. The little dotted line on the bottom left-hand side is the COVID testing infrastructure. And now we're using the US as a moniker here, but it could be Germany, it could be China, it could be anywhere. And what you see is that there's been an increase in COVID testing. In May and March and June of this year, there were 750,000 COVID tests in the United States happening every day. Now we're up at around 1 million, 2 million. The forecast is that it needs to be 5 million. So think about, there's an ongoing demand on the laboratory infrastructure because COVID testing still isn't at its peak position. Look at the orange wavy bar in the middle, the COVID cancer testing bandwidth. And so what you have there in our sense is that there is a steady state bandwidth in the market. The laboratories always struggling to do the right cancer testing frequently, or all of a sudden they saw this amazing drop off of patients. Those patients we anticipate will represent. They may present in ER, they may present with later stage disease, and they may present with a prior COVID diagnosis. And the sense of what we're trying to do with this information is to open up a dialogue, a discussion that says, is what do we need to be ready for here? Because the new normal, that phrase that we've all been part of, that new normal will contain some really abnormal challenges. And the worst scenario is that we're assuming that when we become vaccinated and society start to normalize, that all of a sudden we do not have a huge surge of cancer patients. And I'm not sure that that is the right assumption. I think we need to start to look forward and be ready for what could be a very significant, maybe 2 to 3 year journey where we're both having to find those patients that we missed or having to address diagnostic needs at the same time as coping with a laboratory bandwidth, which is still being put under pressure by COVID. So a bit of complexity there, but that's the hypothesis that we're trying to float.
And I'm sure, maybe I can bring Mark in here. Mark, in your business, this is really critical to you, isn't it? Because, the volume surge that Peter's suggesting we're going to see sometime next year, maybe next year and the year after, sometime that will impact your business significantly. I'm sure your teams would not want to be in a position where they can't service the patients because they haven't got the capacity. So what's your thinking longer term then, Mark?
Yeah, firstly, Peter, thanks for sharing that data. Fascinating, and confirms a lot of the thoughts that I think we've been having for a long time as well. Look, a couple of things I just wanted to outline. At the start of COVID, we made a decision that we wouldn't be downsizing our teams, even though the volumes dropped away. And the reason we did that, a couple of reasons. Number one, we wanted our people to be employed. And number two, we wanted to be ready to respond for what we would consider to be a surge, which we're already starting to see now, because as Peter's highlighted, there's huge drops in cancer diagnosis and screening. If we talk from an Australian perspective, in Victoria alone, there was almost 10,000 less cancer diagnoses in 2020. Now that's not a huge population, but you can do the maths and do the ratio, which means there's at least 10,000 more cancer diagnoses next year. So look, we want to be ready to play our part in ensuring that the people who are diagnosed can receive treatment. I think Peter has hit on a really important point, though. This is not a problem that's going to go away in 2021. We're going to see this for a while. And the other thing that concerns me is, the people who sneak through, don't get diagnosed, or indeed have a very late diagnosis, that will put an enormous burden on the health sector. And in Australia, that'll put an enormous burden on the public health sector, which, needs to be talked about as well. And Kerry, you've heard me talk about this many times. Healthcare is about relationships and teamwork. And certainly we're already seeing more collaboration between the private healthcare sector, which includes ourselves, and the public healthcare sector. Because if we're going to meet the ever increasing demand, we're going to have to work together. The public healthcare sector is not going to be able to solve the problems by themselves, and the private healthcare sector is not going to be able to solve the problems by themselves. One thing that I think is a really interesting point from our perspective, ICON's perspective, is that the real downturn in diagnosis and people receiving care has actually occurred in the public healthcare sector in Australia, not so much in the private healthcare sector. I think there's something to that as well that we're going to need to address, because this is also a socio-economic problem moving forward. So look, wonderful data, Peter. I'd love to talk more about that. I think we're facing a significant challenge, and notwithstanding that we're already facing a fairly significant cancer incidence increase over the next 2 decades, let alone with what this means as well. So a lot of unanswered questions.
Perhaps I could come to you. How do you feel as a leader of your organisation, actually a health leader in the country, about next year? And what are your thoughts and plans at the moment? How are you coping with the potential that this will last a long time, and that, I presume you've seen drop-offs in people presenting with cancer because they're fearful of going into the health system, much as anywhere else in the world. So what are your thoughts for 2021?
So in 2021, the goal is really to get cancer screening back to where it was. And that's largely because cancer screening has been, the PHCs, the primary healthcare centers, have rendered more services to COVID testing and care, and sort of short cancer screening. So we are advocating for more cancer screening centers to resume services. Secondly, some patients are in hiding because they think the hospitals are a source of COVID infection. So there's been a decline. Even though the hospitals are open and receiving patients, there's still a decline in patient entry and inflow. So there's also advocacy and awareness on how the hospitals are taking better measures and following the COVID protocols. From the digital point of view, it is now to integrate and increase the number of people who access cancer screening by recruiting them online. So a lot of patients or clients who walk in, we're exploring how we can attract more patients using the digital platforms and sort of navigate them through. So 80% of the confusion or worries they have can be reduced, and they have confidence in the healthcare system they're going to. So really, that's our idea for 2021: increase cancer screening, increase access, and get more patients to adhere to their treatment.
I think that's going to be a common challenge around the world for everyone, because COVID certainly is going to affect everyone next year, despite the fact that we have a vaccine. Ulrika, I'm interested in your part of the world. Have you witnessed a similar drop in presentations, and what are your current thoughts?
Definitely, and we have the same figures and the same scenarios that you showed so elegantly, Peter. And we launched a report on that, and then what we see for the coming years in terms of not early detection, that is really important, but late detection of cancer and the mountain we see ahead of us. And some of the thinkings ahead is, from an organizational perspective, we're looking into sort of how is the pandemic on a long-term basis affecting cancer research in Sweden, and how can we step up as funders of research. And we're looking at also securing funding and make our fundraising activities sustainable for the coming years. But I'm also a bit worried about the infrastructure, not looking at our own organization and the needs we meet and the vision we have to sort of the objectives we want to meet, but looking around in Sweden, what's happening to smaller organizations, like all the smaller patient support organizations in Sweden. They are having a really hard time because they don't, it's easier for us as more established organizations to continue and to change the way we're working and work differently with advocacy or whatever. But we need to support the infrastructure with the smaller organizations as well. So that's something we're looking into, both supporting them financially and in other ways. Because if that infrastructure falls, it's not easy for another organization to step in and just start from the beginning. So we feel that we have some kind of responsibility, not just to meet the needs of our own organization, but to see a bit beyond that, because the infrastructure is for all people affected by cancer in Sweden, in the Nordic context. And we think also there will be an opportunity in the coming years to talk more about primary prevention, to talk more about prevention in terms of healthy habits, and there's a window opening there where we can work with other organizations, the Heart and Lung Foundation, for example, and to talk about this in a way that we can sort of have a discussion on what can the government do, what can different stakeholders do in this area. And that window has opened actually thanks to the pandemic. And that's a bit hard, might be a bit hard to say, but I think that is something we can focus a bit more on for the coming years. But otherwise, sorry, Kerry, I'll stop there.
No, that's fine. I think we're drawing to a close. We've got the last minute or so. I'm not a great one for saying, have you got 1 minute, one thing to say? Does anyone specifically want to cover anything? And I maybe will do a bit of summary. Mark, is there anything you want to cover, or Peter or Omo, anything you want to say?
No, I'm happy, Kerry. Wonderful conversation, and wonderful to get a group of people together to talk about so many common challenges.
Yeah, it's incredible, isn't it?
The only thing I would say is, just listening to Ulrika, Omo, Mark, I think the globe is sharing the same perspective. That has to be a unique position.
It is.
Something is important there.
Yeah, so maybe I could just draw some broader conclusions from that discussion. And thank you very much to Mark, Ulrika, Peter, and Omo. It was really very, very interesting. I guess some key points for me is that at the beginning of this crisis, some things that came across was the ability of the leader to stay calm, to communicate, and to make great, quick decisions. And by doing that, engage all the key stakeholders around that clarity of, this is how we're going to deal with the situation. And I think through the conversation, what we've seen is that as we've become more aware as leaders of the nature of the challenge that we're facing through society with the pandemic, and how the governments are responding, how society is responding, we're now in a position where we're thinking longer term about what does this mean for us, both in opportunity and looking for the positive outcomes that could manifest themselves as a result of going through a period of fear, a period of crisis, and that movement is really important for the long-term safety, stability of organizations, and also the delivery of the mission that we each have, whether that's UIC supporting its members, Mark supporting its staff, delivering services to cancer patients, Peter developing great products and services for his cancer patients to be diagnosed in the future, or Omo and her patient support groups, to help them. So I think it's been interesting to see the leadership journey through this, through crisis and fear to an understanding and planning. And I hope that we don't lose that ability to make quick, great decisions, because I much as I love long-term reviews and evidence gathering, I think we've actually proved to ourselves as a community. Just bear me a second. I'm getting a phone call from one of my team. I think we've learned as a community that we can make quick decisions with not necessarily all the information, but we can make the best of those decisions to take an organization forward. So again, just to repeat, thank you very much to the panel. Thank you to Alessandro for arranging this, and Lorenzo as well, somewhere on the screen. Thank you very much for sorting it out as well. I hope sometime, Mark, I'll be down in Australia. We can share a cup of coffee or a beer if you tempt me, and watch a game of cricket. That would be great. Ulrika, I'd love to come to Sweden in the summer, only in the summer. I'll tell you that now. Peter,
it's grey now.
Peter, let's hope we meet at ASCO some point in the future. It would be great to get that community together. I'm sure we will meet. You're the CEO of the year, so we're bound to meet during the year at some point. And thank you everyone for dialing in. I hope you found that as interesting as I did. So thank you very much indeed. Cheers. Bye-bye.
Thank you.